Ladies and gentlemen, welcome back to another fabulous episode of the Healthcare Trailblazers podcast. My guest today needs no introduction, both because he's awesome and also because this is his second time back. So excited to have Zev Neuwirth today. Zev is not just a doctor, but an extraordinary author. Like I said to Zev right before we turned on the camera, it's very easy to be an author, but it's a little bit harder to be an author of interesting books. And Zev is definitely an author of interesting books. And the other thing that I want to call out is I always encourage authors to read their own books for Audible and not hire somebody. And Zev did that. Now whenever I talk to Zev, whenever I talk to you, I hear this calming voice from that read this book because I'm a listener. So when I listen to Beyond the Walls, now I feel like I really know you. So anyways, long intro, but good to see you again.
Mendel, thank you. And just want to say you are an inspiration to me. Every time I talk to you and learn what you're doing, it's just, you're doing the right things. And, it makes me, it's really encouraging to have people like you in healthcare and really moving the ball forward in the right direction. So thank you.
Zev, let's catch up a little bit. It's been maybe a year since we talked last on the podcast. You had just come out with the book. Let's start there. How has kind of the feedback been from Beyond the Walls? I'm sure you're already working on your next one, but just catch me up on what you've been up to since our last chat.
Yeah, that's so funny. You mentioned the next one. So I've written 2 books, right? And it's so interesting. I'll go and I'll speak, and people come up to me and they're like, "Oh, when's the third one coming out?" And I'm like, did you even read the second one? So it's a lot of work to write a book. So I've been actually really focused on actually work itself. I think that for me, the writing comes out of the doing, and in doing and thinking and experiencing and listening. So the idea of churning out another book too soon is, I really want to learn before and really grow, and then share that with others before the book comes out, the next book. But it's really interesting. So I have been going around the country and speaking to lots of groups around the Beyond the Walls concept, which essentially came out of many years, 5, 6, 7 years of podcasting and listening to entrepreneurs and experts and in healthcare, and realized there were these 3 major strategies. There was the digital strategy and digital enablement, which is just critical for healthcare. I would actually put it this way: there is no such thing as digital health, because quite honestly, all health is digital at this point. If digital shut down, I'm not even sure what healthcare would look like, but it's absolutely a necessary table stakes to be in the future development of healthcare delivery and healthcare. So the digital strategy, and on the other end, there is something that most people aren't really aware of, which is really, it's fascinating for me, someone who comes out of the clinical domain, and I spent many years doing clinical redesign and clinical care delivery and clinical care transformation. What's fascinating is the third strategy. I'll come to the middle strategy, but the third strategy of the 3 is really around business model transformation. And I actually think that some of the most transformative changes in healthcare lay in the business model itself. And so these are things like, the kinds of partnerships and collaborations, the new payment models. These are all business model transformations. And I was certain of that when I wrote the book, because again, it was based on years of empirical evidence, but I am even more certain of it now after the book's written. As I look and learn more, business model transformation is absolutely going to be maybe the key to unlocking the future of a really humanistic healthcare system. And that leads to the third strategy, which is the most important one, that ties the digital and the business model together, because you could have a lot of technologic advancement and you could have a lot of business advancement, and they could lead to a very, what's the word, dystopian future. And so what you really need and what I really observed is that the folks that are really changing healthcare, they're being led by a humanistic strategy. And by humanistic, I mean very, very specifically the elimination of racism and sexism and ageism and ableism and classism and industrialism in the delivery of healthcare. And those are very, very specific, and they can be measured. Um, and um, and so it's that humanistic strategy enabled by digital and the business model transformation. And so I've been going around the country sharing examples of what that looks like, and hopefully it will serve as a guide for others who are interested in really humanizing healthcare and really improving healthcare in that way.
Yeah, maybe you can share one of those examples because I'm still trying to understand what you mean exactly by the humanistic part to it, or what the strategy part is.
Yeah, I think one example of humanism is a humanistic strategy has to do with a lot of these Medicare Advantage companies. And I like to refer back to ChenMed quite a bit. So ChenMed, and I'll go through it exactly very quickly. ChenMed is actually one of the most digitally enabled companies in the world. Without getting into too much detail, it's a Medicare Advantage. It's a senior care company. They take care of older people, particularly those who have multiple medical conditions, so a sicker population and a poorer population. So Medicare and what we call dual eligibles, that sort of crossover between Medicare and Medicaid. And so they take care of older, sicker, poorer people, and that's their sort of demographic patient population. And so they are, let me go to the digital part. They are the most sophisticated. I actually think, if not the most sophisticated, one of the most sophisticated provider groups in the world. So much so that they created a tech company to sit alongside their provider group. They actually have a technology company that is separate from the provider group. And the tech company builds software that enables providers to really identify who's not who's sick, but who's going to be sick. So that predictive analytics, the tech company builds a platform that allows providers to have the most up-to-date evidence-based medicine protocols at their fingertips. So you're not sitting there, looking online and trying to figure out what is the latest protocol for that hypertension treatment or that COPD treatment. No, that's not how it works. They have an army of people who are developing and updating those sorts of things all the time. So it's incredibly tech enabled. They have their own electronic medical record proprietary that they built specifically. This is it. They built it specifically for their patient population. So it is designed to help providers and the provider team, because it's not just the provider, it's to help the provider team take care of that type of demographic, the older, sicker population. So incredibly digitally enabled. I mean, so sophisticated. Most people can't even, I have a hard time even understanding. And then on the other side of it, their business model is a new business model. It's Medicare Advantage. It's a capitated model. Still, the minority. I mean, most of healthcare, 95%, 98% is really still fee for service. Even if it's value-based care, it's largely fee for service. They don't do that. It's 100% capitated model. And so it's a real business model transformation, which changes the way they work. It changes the way they practice. It changes the way they pay their doctors and staff, changes everything. So the business model has been transformed. But the thing that is really most inspiring about them is that they're driven by a humanistic cause, by a humanistic strategy. And if you talk to their founder, it was Chris Chen and his brother Gordon Chen, and their father, who was a physician for many, many years, delivering care to poorer, older people in Miami. If you ask, what is your mission? What are you trying to do? And this is the thing that is so radically humanistic. Chris will tell you. In fact, I posted an interview on my site HRL, which I think we'll talk about hopefully. But Chris will say one word, and well, he says, Zev, and he's said this to me for 10 years now, but he says it every single time. He says, Zev, what's different about us is we love our patients. That's it. We love our patients. We hire our staff, we hire our doctors with the criteria that they are absolutely passionate about caring for people. And he gives examples. So when COVID hit, when the pandemic hit, they knew that these older patients were stuck in their homes and they were lonely and isolated, and they knew the impact of that on their well-being and their health. And so they gave every doctor a stipend. I forget if it was $1,000 or what it was. And they gave every doctor, and they said, listen, use this money to show your patients how much you love them. And Chris would tell me stories of doctors who literally would go and buy flowers and literally go up to people's homes and their apartments and ring on the doorbell. This is the doctor. And say, with a mask on and gloves, and say, Mrs. Jones, we've been thinking about you. I've been thinking about you. I know it's a hard time. I just wanted you to have some flowers to remember that by a small token. Or they bring them food, or or they did bring them food. They have a transport system with minibuses. They would bring food to people who didn't have food or was hard to get food. So this is love. At 5 o'clock, they closed their offices and they turned their offices into social halls. Obviously not during the pandemic, but they've been doing this for years. I mean, people have been talking about social determinants of health. They've been doing this for a long time, but it wasn't a transactional phenomena. It was out of a humanistic mission. And let me just say one last thing about this. Most practices around the country, most primary care practices, they see everybody. They see an 18-year-old, a 22-year-old, a 35-year-old, a 45-year-old, a 65-year-old, and a 95-year-old. Let me ask you a question. Do you think the 95-year-old needs the same sort of medical care as the 25-year-old or 45-year-old? The answer is of course not. But when you're 95 years old and you walk into your doctor's office, it's no different than the 25-year-old that walks in. Same people, same resources, same protocols, same everything. ChenMed realized years ago that an 85 or 75 or 95 needs something radically different from a 35 or 45 or 55 or even 65-year-old. So they built their entire model around the needs of older people with complex chronic conditions. That's love. That's humanism. Not some generic peanut butter, you're the same as anybody else type of thing. So that's a point of view, but for me, that was a very humanistic point of view. And again, humanism enabled with the state-of-the-art digital, beyond state-of-the-art, it was beyond what anyone else was doing or still is doing, coupled with a business model transformation that they have been a leader in, by the way. They were doing Medicare Advantage before anyone could even spell Medicare Advantage. They were doing this way ahead of the curve. And so that's, when you ask for an example, that's for me is just a phenomenal example of beyond the wall strategy.
Yeah. And it's great that you brought up ChenMed as an example, because I too am quite a fan. I had the opportunity of I was on the Gordon. I feel like people are either on the Gordon side of the company or the Chris side of the company. I landed on the Gordon side of the company, and so I had the opportunity of having him on once remotely, probably about 2 years ago, and then last year I actually went down to their headquarters in Miami, and we did an on-site podcast as well. And so I got to spend some quality time with Gordon. And yeah, I couldn't agree with you more. There's a very, very deep, very, very deep humanistic driver to them. On the Gordon side, at least, there's also a very deep religious drive, very deep. He was very clear about that. But I think those two things go together, because I think that maybe religion is maybe the purpose of why why you're so humanistic. But at the end of the day, that's the humanism is still the path, so one might be the car, but one's the road, right? So I think that you're spot on there. And I wasn't going to ask this, but I got to ask you. I mean, you bring up ChenMed, and even with ChenMed, like everyone was thrown into like big turmoil last year when CMS put out this recalculation to some of those, capitation reimbursements, and it always is troubling to me. And I'm hearing different sides of this conversation. Like I've mentioned now at this point a couple times. I was recently with the CEO of Advent Health down in Orlando. Beautiful campuses over there, and he had a really really good kind of perspective on taking a bird's eye view on this whole thing and saying all this is normal. We've been in value-based care since the 90s, and you got ebbs and flows, and the government kind of figures things out and then adjusts and pivots and whatever, and this is just part of the norm. But on the flip side, it just, when the government has the power to, the government is, they're the biggest payer, right? And when they have the power to throw a wrench into an operation like ChenMed or the other value-based care operations like that, I don't know, it's troubling. How do you view the kind of public-private partnership, or how do you view building businesses around models that can just be turned on their head at the flip of a dime, so to speak?
Yeah, I don't know that what the government's doing in terms of regulating some of the codes and paying less for some of the codes or combining codes. I'm not sure that's really dramatically changing the notion. I mean, Medicare Advantage again it is value-based care, so it's a capitated model. It's the idea that you're trying to disincentivize overutilization and provide these providers with a capitated payment so that they can put those monies into resources that aren't dependent upon visits or encounters or procedures, but are more preventive in nature, right? And so the idea is still a strong idea, and I think it's fundamentally it's spot on. It's directionally correct. It's the law of unintended consequences, right? And so the problem, if again, if I'm being really just direct about it, I think one of the problems was that one of the ways that Medicare Advantage companies and providers made money is both the middlemen, sort of the payers as well as the providers, is that you have to, and this is well-intentioned, you want to code for the severity of your patient. So if I'm a provider A and you're provider B, and I'm taking care of sicker patients, I probably should get more money, right? Because my patients are sicker than your patients. And so that's the coding of Medicare Advantage. The problem, or the unintended consequence, was that we all began to play the coding game. Yes. And so yes, some people would say it's over coding. Some would say it's optimizing the coding. But the game, we actually focused on the game instead of on the patient. And some, to be, again, very transparent about it, there's been a lot of literature, really great feedback. Don Berwick was one of the leaders in this early on, before most of us were even aware of this. People, publishing articles on how really the money wasn't and the resources weren't being put into what they were intended to be, which is like giving people things like eye care or ear care or transportation services or other preventive services. It was, or podiatry services. Again, we're talking about older people, and the money was put into building technology that was essentially made to optimize coding. So to wring out as much money as you could, and paying doctors to upcode and optimize coding. So, I think some people called it profit, focus on profit over patients. Some people called it greed. But clearly it was, I would say, misguided. It was, and again, it's kind of interesting that I think what happened was they lost sight of the fact that remember that humanistic strategy I was just talking about? So I would say, the short answer to your question is they didn't follow the beyond the wall strategy that I outlined very clearly. They lost sight. They focused so much on the digital enablement and the business model that to what I said before, we were starting to go down through to a dystopian future. as opposed to a humanitarian or humanistic future. And so I'm serious. This is not a joke.
Yeah.
This is around.
Yeah.
This is around. I mean, This is our parents. Eventually, it's going to be us. It's going to be our spouses. This is serious. I mean, you know, healthcare is not. I mean, if we treat healthcare like any other business, and we're just focused on the profit and on the business itself and on the all that other stuff, and we lose sight of the fact that we're trying to actually help people. That's the point. That's the purpose. And I think that they lost the middle strategy, which is humanism. And they should have read the book Beyond the Wall, so this wouldn't have happened. I should have written it sooner.
Yeah, as you even started speaking, before my mind came to the same conclusion, which is that I thought it was a disjointed question, but it actually fit very well, because you're absolutely correct. You can make laws and you can make regulation and you can create programs and you can create structures and reimbursement models from today till tomorrow. But if people's intentionality is off, if people's if the reasoning is off, then nothing's going to help, right? I mean, as you were speaking, kind of reminded me. There's a famous story of a certain area that was being developed or inhabited. People kind of moved there and set up a small town, and they had this huge issue with cobras were coming and killing people. I'm sure you've heard this before, but cobras were running rampant through the town. So the government got together and they decided to put a bounty on the cobras. So they said, whoever brings a cobra in will get $10. And so before long, all the townspeople started breeding cobras. Right, and that's basically the same. If you don't think it through, that's kind of what happens. Right?
Oh my God,
it's kind of the same thing.
That's funny. That's a good story.
Yeah.
No, it's yeah.
But so I'm happy we kind of came back to and you know what, I actually really appreciate what you're doing, because when we started this conversation, I said, "Oh, are you writing your third book?" And you said, "No, I'm trying to live and act out, beyond the walls." And I think that what we're about to get to, there's this new movement that you're starting that I think is maybe more powerful, is a lot more powerful than just writing another book. Because it's really trying to take the ideas that you talk about in Beyond the Walls and really turn it into a movement that can pull people in and create maybe this intentionality. So, I had Dr. Robert Pearl on a while ago, also for his second time. And I'm pretty sure he said this ironically, but he basically said that because he just wrote his third book, and he said, well, I wrote a book and I waited for healthcare to change and nothing changed. So I wrote a second book, and then I sat and I waited for healthcare to change and it didn't change. So now I wrote a third book. And he's great, obviously, but talk to us a little bit about, I think it's a really cool way to move from a book to really doubling down on what you're clearly passionate about. So talk to me about this new movement that you're starting and what it's called and what you're trying to do.
Yeah. So first of all, I absolutely respect and admire Dr. Pearl, Robbie Pearl, so much. I consider him a mentor and a teacher, and he's such a powerful leader and brilliant. I mean, just so brilliant. But here's what I say. It's kind of interesting. I'll pick up on what you said. I'm not waiting for healthcare to change. I'm actually actively involved in, and I think it ties in. Well, why aren't you writing? Not that you asked this, but why aren't you writing a third book, or when are you going to start to write the book? Well, I'm working on actually changing healthcare. I'm not waiting. And the writing of the book is part of that, and eventually I think that will come. But right now, I'm really, really intensely focused on actually proactively committing myself to changing healthcare and humanizing healthcare. And so I've learned there's 3 lessons, and I'll do them quickly, that I've learned over the past year. Actually, to be honest about it, I won't say I learned them. I had to relearn them because I knew them before, but I forgot them. And as I was going around talking about Beyond the Walls, I would get this question, Zev, I hear all this stuff. Wow, ChenMed, all these other things going on, hospital at home, what the VA is doing with whole person care, which is, just groundbreaking, all these collaborations. But, everyone kept on asking, not everyone, but a lot of people asked the question, but what can I do? What can I do? The system is so overwhelming. I'm just one person. What can I do? And I really argued with these people for months and months and months. And finally I realized, oh my God, they're right. They can't do anything. An individual cannot do anything. What it's going to take is a collective, a network, a community of leadership that is focused on really humanizing healthcare. So that was a big aha, because I really struggled with this for months and months and months, and debates and arguments and in public, right? I mean, I would be standing in front of hundreds of people, and an executive physician or executive administrator in healthcare would stand up and say, "What can I do?" And I finally realized, you're right. We have to do it. We have to do it. And so I realized we have to form some sort of network or community. That was lesson number one. Lesson number two was if you look at the healthcare system, if you look at the paradigms we're in, and I wrote my first book on reframing healthcare, this notion of reorienting it and redefining the problems. If you look at the challenges, we're in sort of this paradigm of this reactive, what people call sick system, right? It's a disease system. And again, not to knock it, but just, it probably is not enough. And in some ways it's misguided, and it's a little bit self-serving, right? Because we make our money on disease and sickness and illness, as opposed to health. And so I started to realize as I talked to people, because there was another voice. There was a set of voices that were like, no, I'm going to do it differently, right? And I've been interviewing these folks for now over 10 years, and I've been writing about them in these two books, and now I'm talking to them in these audiences over the past year or so, and it sort of clicked that these folks that were actually really doing something, they had a rebel mindset. They were not going to follow the status quo. It was really quite obvious after I realized. It was like, oh my God, you're a rebel. You are not going to follow the party line. And so I started to call them, because they were rebels, but they were rebels in the way that the Chens are, like humanistic rebels. They were like, no, we're going to treat people with loving care, and we're not going to do the same old, and we're not going to follow that pattern. No, thank you. And they all had that same rebel humanistic mindset. They were all humanistic rebel leaders. And I started to actually codify the difference. And it's actually remarkable. I mean, this could be book number 3, but the humanistic rebel leaders had a very different mindset than those who weren't. And I actually have a whole bunch of things. Like, for instance, humanistic rebel leaders, like people who are not humanistic rebel leaders, they're very influenced by the current environment. So, whatever's going on now, that's, what can I do? I'm just going to act in this way because this is what's going on. Humanistic rebel leaders are not driven by their condition. They're not condition oriented. They're purpose oriented. So they're saying, I have a purpose. I have a mission. What I find myself in now is not going to deter me from that. I'm not gonna do based on my current conditions. I'm going to do based on my commitment and my purpose. And that was like that's not even like a subtle thing. I mean, that's like you live in two different realities. And so that was just one of many different mindsets. And, so that was a second realization, that there was this humanistic rebel mindset. And the third was that, and this actually happened very interestingly. I was asked to be part of a panel, and someone said, and the woman who was facilitating it said, Zev, I want you to talk about health on the panel. The panel is going to be about health. And this came out of my mouth, and it sounds so ridiculous, but it was a complete, like, it woke me up. It took a while, but it woke me up. And I said to her, she said, Zev, we're going to talk about health. And I said, oh, no, you don't understand. I don't talk about health. I talk about health care. And I said that. And she was like, well, no, but I really want to have this panel about health. And I argued with her. And this went back and forth for weeks. And I argued with her, and I said, no. I don't talk about health. I talk about health care. And all of a sudden it hit me like, oh my God, isn't that the problem? We're so focused, and it even goes back to your question about Medicare Advantage. We got so focused on healthcare, on the industry, we forgot that this isn't about the industry. This is about health. we lose sight of the fact. And again, it's not that it's bad intention. It's just misguided. You know, it really is misguided. You lose your way. And so I ended up talking about health, and it like took me right back to like, isn't this why you went into medicine? To actually help people get healthy, not to become an expert in healthcare or to the purpose of my career, the purpose of all our careers should not be to make healthcare better. It should be to make people healthier. That's really the point. We have a 4.3 trillion dollar healthcare industry. The healthcare industry is doing fantastic. It's a healthy industry. The people are not healthy. The people are dying. The people are getting sicker. The people are getting poorer because, I mean, of our health care. And these are facts. I mean, if you want, I could go into a litany of facts and stats. So we have really become a misguided industry. And again, I think people are good. I think that collectively we aren't doing good. And so these three things together, the focus on health, the realization that 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 the people who were actually really focusing on health again were actually these humanistic rebel leaders, and the fact you needed a community to actually do this, that it wasn't possible to do alone. I put all that together and I said, okay, I'm going to form a community of humanistic rebel leaders, and so I that's what I did, and so I have this online community which literally just started like 2 weeks ago in August, and it's called #HRL. So people could go and look it up, or you could go to zevhealth.com, Zev with two E's, Zeeev health.com. Go to my website, and you'll see the membership site. It's #HRL, Humanistic Rebel Leadership. And it really is supposed to be a network, a community for connecting with and collaborating with and partnering with and learning from and teaching others who want to be part of this community to really humanize healthcare. And it does require a rebel leadership mindset. So I have content on it. Obviously, well, not obviously, but I've been recording interviews with amazing people, and the focus is on leadership and health, and that crossover. And so it's different. I don't think anything like it exists out there. And I think it is much needed. And, hopefully I'll do a good job of bringing people to it, and hopefully they'll sign up, because it's all about membership. It's all about, it's all about bringing people together. So I'm excited about it. I don't want to over control it. I don't want to over manage it. I don't want to over determine it. So, and in fact, like I was just interviewing someone the other day, and this wonderful physician who's really dedicated her life to taking care of disadvantaged folks, and she's an expert. She's triple boarded in family medicine and sleep medicine and substance abuse, addiction medicine. Amazing physician leader. She's a young Black woman and physician. And I said to her, "Oh my God," her name is Jamila Battle, Dr. Battle. I said, "Dr. Battle, I want to get your name out there. I want to get your." And she said to me, she said, "Zev, I feel so alone. I feel so marginalized." And I said to her, "Oh my God." I said, "I'm going to post this on the #HRL, the Humanistic Rebel, because that's the whole purpose. I want others to see her. I want her to see others. And what can happen?" She said, I'm looking for partners. I'm looking for collaborators. I was like, this is the site. This is the community. Go there, sign up. Already there's dozens and dozens of leaders who I am sure one of them is going to be the person you need to speak to. And that's just the beginning. Wait till there's thousands of people on it. Then it'll become, can you imagine what 1,000 humanistic rebel leaders could do if they were, on a site together? Literally could change.
What's the interaction on the site with the community? What's the medium? Or
yeah, it's on a platform where it's not dissimilar from others, where you basically can have one-on-one, communication. Everyone's on it, so you can see who's there. You can message them individually. You could start a thread. So let's say, Mendel, you're interested in care coordinators, right? And you're like, I want to radically improve care coordinators, and I've got this platform that'll just, make them more efficient and more effective and save them time. And you say, you want to start a conversation, or even it's actually called a collection. You want to start like a mini site on this site. You can actually do that. The site would allow you to start a mini site, and then everyone on there who's interested in care coordinators joins your site. And all of a sudden, you're exposed to hundreds of people who, number one, as someone, if you're saying, listen, I got this software program I want to share with people. That's number one. Number two, maybe there's people who want to partner with you or collaborate with you, or maybe you're looking for people to work with you and join your company. Who knows, right? I mean, I don't know. I don't want to overdetermine it, but you think about it. This is how it works, right? I mean, that's the power of networking. It's like, I'll tell you, my entire career, which is now, I'm not going to tell you how many years, but I have not once gotten a job through a headhunter. Every job I have gotten is through a human connection, through a friend of a friend of a friend, through a colleague. Every single job, including the one I'm probably going to go into in the near future. It was through literally someone walking up to me and saying, "Hey, we were at a conference, and I heard you speak, and I think you would be interested in this thing." And I thought at first it was just going to be a conversation. And then it turned into a phone call. And then it turned into a Zoom call. And then it turned into an in-person meeting. And next thing I know, I'm consulting for them. And next thing you know, I might be working for them. And it's just like, you see what I'm saying? That's the power of community. That's the power of network. And if you're all aligned around, and the membership, it's a membership site. It's $12 a month, which again, I think is not too much. By the way, if people can't afford it, we will waive the fee, because we don't want that to be an obstacle. But it's you're actively joining to be part of this humanistic rebel leadership community. And what will happen if it's successful, and I'm hoping it'll be successful, because we just, people need it, leaders need this. Being a humanistic rebel leader is a very, very lonely thing, and it's
Yeah.
I hear that a lot. People feel isolated, alone, drained, and together, I think we could really help each other.
Beautiful. Wow. Well, Dr. Newworth, definitely call to action. If you identify as a human rebel, what do you call it?
Humanistic rebel leader.
Humanistic Rebel Leader, then go look at Zev's LinkedIn profile, and I'm sure you'll find the link. Is it in the LinkedIn profile somewhere in your links?
I'm sure it is, yeah.
Okay, so go there. Also, if you're not already following Zev, which I highly doubt, go follow Zev on LinkedIn. And I'm excited. I'm really excited. It sounds like something magical you're putting together. I'm gonna go sign up, and
thank you, man.
And I'm excited to check in 6 months, 12 months down the line and see how this movement continues to grow. So. Zev, thank you so much for spending time today. This is exciting.
Mendel, thank you for all you're doing. And actually, you and I are going to follow up about some of the work you're doing, because I'm interested in it.
I appreciate you. Thank you so much.
Bye-bye. Take care.